Tonight, 8 News anchor Amy Lacey shares just a few examples of how they've turned their early struggles into helping their community thrive.
There's just something about Hollywood Cemetery on a sunny spring day that helps to put it all into perspective for Aiden O'Connor.
There's a lot of kids here and a lot of people that didn't make it. It makes me think of how blessed I am to have made it this long and made it this far. You know, I've fought ever since I was a teenager.
Aiden started life as Vanessa, living in small towns across the Midwest. Born a girl, feeling different, a lot of the time in pain.
You know, I was to the point where it was either I transitioned or I killed myself.
Aiden started taking male hormones in March 2013 at age 29, sadly losing a support system.
I haven't talked to my mom in almost 2 years now.
But Aiden finally gained a true sense of self. He's a husband and father to a stepson and biological son living at home, and now shares his story to open eyes.
There have been times when I've, been out in public and people have called me an it.
There isn't a hierarchy. We're all people. We're all humans.
Afton Bradley moved to Richmond from Albemarle County right out of high school about 8 years ago. Born a female, Afton could only put a name to what he felt his whole life after doing an internet search: transgender. He came out to his parents at age 16.
They were just as lost as I was, and they were just seeing their teenagers struggling with self-injury, with suicide, with drug use, like lots of different things, and just trying to help.
For help, Afton came to Fan Free Clinic, which is still the only free clinic in Virginia offering hormone therapy and other transgender-specific health care.
Transgender people do experience a lot of discrimination, violence, and just rejection from all aspects of the community, from family, friends, co-workers, and the medical profession.
Being a patient here empowered Afton to get a master's degree in social work. He came back to the clinic to help others like himself make a positive name for themselves. Not just the hate crimes and controversies that push this group into the spotlight.
You see the trans community as something, as an other, as something that is constantly being oppressed, and you just see all these negative attributes. And one of the things that we really work on is to kind of catalyze and empower identities and communities, just kind of erasing that other and seeing that the trans community is just as diverse as any other community.
For them, there are support groups, and Aiden is starting his own. He keeps a list of all the known trans teenagers nationwide who've taken their lives this year.
These kids are my child's age. What kind of society do we live in when our babies are killing themselves because they can't be accepted? I've been there. I've been to that dark place where nobody cares, or you think nobody cares. And look where I am now.
Aiden is determined to keep the conversation about gender going in Richmond. And on this day, a look around Hollywood Cemetery really does put it all into perspective.
There are people here that have, that were alive 100 years. Maybe it gives me hope that I can make it that long.
Amy Lacey, 8 News.
Right now, Fan Free Clinic provides services to 70 transgender patients in our area, and there is such a need for services that Dr. Crawford is working with other local physicians to help with this specialized care.
So if you or someone you know would like some help, you can call them. Fan Free Clinic number is 358-8538.
We're back now with our special report on gender. Following Bruce Jenner's announcement, so many people are talking about being transgender, including here in Richmond. Here's one local young man's story.
The oil that is dripping, this is a crime.
This project has been a lifetime in the making for Dan Oster.
Record myself now, and I'm going to compare it to when I've been on T for several months.
T is testosterone, the hormone the 18-year-old will begin taking in just a few weeks.
On May 26th. And I'm really excited about that because it's like it's been an 18-year wait.
Dan was born Danielle and has known he was meant to be a male since childhood.
Other kids would draw themselves like as the princess or whatever, and like I drew myself as the prince.
Dan kept it inside for years. In middle school, finally mentioning his gender struggles to counselors. But it wasn't until age 16 that the Hanover High School student knew it was time to talk. really talk with his family.
I would run home after school. I would go upstairs, like put on a huge sweatshirt and like put on a hat and put like my long hair under it and just like go about my day and like take pictures of myself and like try to convince myself that everything was okay. But then I realized like my parents were going to realize what was happening. When I did come out, it did take them like that year or two to kind of be like, okay, this is how it's going to stay. This isn't some phase or anything.
I was quite blindsided by it.
Mom Christina says she had no clue, and it took time and counseling for her family, including Dan, to get to where they are now. Acceptance.
It does feel like the death of someone for a while, till you realize it's not. It's the same human being, just with a different pronoun. Transgender, you look in the dictionary 20 years ago, there was nothing. It was a disease, a sickness. And now those, definitions have changed so much.
I was married 4 times, thinking that I'd find the right woman that could fix me. Well, the only way to fix is to accept yourself and to live as who you were supposed to be born as.
Carrie Abrams understands the Osters' pain, all of it. As a boy in the mid-1950s, Carrie says there wasn't even a word to describe her transgender identity.
Kept it hidden, and I hid it all my life.
Carrie hit an especially low point 5 years ago at age 55.
I had to make a decision in life. It was either commit suicide or do what I knew I had needed to do for most of my life.
Carrie, who's worked as a motorcycle technician for decades, came out to family and friends as a trans woman. Now through local support groups, she helps young people.
If one person gets anything out of it, then I'll do whatever I have to do.
Being accepting is the most important part. It hurts, but I try to stay strong to help him, and I just want to help him.
His family is a fierce support system as Dan balances high school, 2 jobs to save up for surgeries, and daily challenges.
It's everything from bullying to just not wanting to use a credit card because my birth name's on it.
There are reminders of who he was, but also excitement for who he's become.
You're very brave. Yes, we're very proud of him. Very proud of him.
This summer, Dan will leave for college. It will be the early days of his medical transition. And this project will be in full force. With every word he records, Dan will capture the greatest change he's making in his life. And he has this to say to anyone who questions if he's really ready.
How long have you been sure of who you are?
Now, the American Psychological Association says it is so important that families offer support to children and teens with gender struggles. Feelings of isolation or being forced to wear certain clothing or act a certain way can lead to depression or suicide. The APA recommends educating yourself about the issue. Use names and pronouns that go along with their gender identity and talk with a mental health professional. As the Osters learned, a gender transition does not just affect the people going through it. It affects everyone close to them. In health news now, when you're transgender, finding a doctor who understands your specific needs can be a challenge. So now the VCU School of Medicine is taking a new step to help.
Rob Phillips' Chesterfield consignment store continues to grow.
You have enough tags for this?
Yes.
And now, along with professional success, he can finally celebrate who he is personally, too.
Oh, it's awesome. I feel more at peace.
Phillips began transitioning from female to male 3 years ago, after decades of feeling different. Weeks after starting testosterone, the now 43-year-old suffered a stroke, ended up in the hospital, and faced the unimaginable.
I felt I was on exhibit of some sort while I was there. They actually started funneling a lot of people in. I felt like a freak show almost.
Healthcare and the transgender population have not been friends, and there are a lot of horror stories.
Horror stories including violence, abuse, misinformation, and limited access to care, according to Dr. Taryn Witten. She's been doing lectures on trans research and medicine for the past 7 years at VCU, and knew the issue reached a turning point when student Courtney Saw approached her about developing a transgender health course.
We're hoping to address with the physician-patient relationship to develop a comfort level and a good rapport with the patient so they feel open in the first place.
It's kind of like a buffet course in a way. They'll get a little bit of a lot of things. It'll at least give them a starting point for what do you do when somebody who's trans walks into your office and says, I need help.
The elective will begin this fall for fourth-year medical and nursing students. But members of the Curriculum Council are hopeful this is just the beginning.
Other schools might see this and be able to either incorporate similar or the same sort of curriculum in their programs.
There are an estimated 700,000 transgender people living in the U.S., and that number is expected to grow as acceptance does. Phillips applauds VCU for being a part of the solution.
I know a lot of my friends and myself are afraid to go to the doctors, and it's awkward, and it's like we have to educate the doctors.
But with more awareness, that's changing, offering more options in this new chapter of Phillips' life.
I feel more confident. I'm out there. I am more of an extrovert now, and it's just wonderful.
And right now, this is an elective course. It will be focusing on a couple of different areas: primary care, endocrinology, psychiatry, and some other specialties that really do help the trans community. Eventually, though, there's a possibility it will change and it will be standard course for all VCU medical students.
Well, no matter what you think about it, ethically, morally, religiously, when it breaks down, it's a medical problem for the person involved. And they probably deserve care.
It is a medical issue, and it's great to see a population that has traditionally been underserved, as they tell me, having more resources now.
Good story. Thanks, Amy. Welcome back. Friday will be a Transgender Day of Remembrance. Across the country last year, a reported 23 transgender people lost their lives.
It is an issue hitting too close to home for members of our local community.
Because of the fact that there are those out there that can't.
3 individuals, 1 vow. Gathered at Diversity Richmond, they plan how they'll honor lost lives at Friday's Transgender Day of Remembrance ceremony.
Every year I attend them, and I always hope that it's the last one.
Michelle Marie Mackay has been a part of the memorials since they started here just under a decade ago. Some of the victims, friends, allies of Richmond trans men and women. Honored this Friday, Lamaya Beard, shot to death in Norfolk this past January.
Out of respect to the family, I just can't mention the name.
Carrie Abrams says a local trans man was killed at the hands of someone he knew about a year ago. And there was Amari Hill, found dead in a Richmond alley in November 2013, just days before her 23rd birthday.
We've had transgender individuals right here in Richmond, Virginia, our own backyard, that have died violent deaths to the hands of hatred just because of who they are.
Sage Smith will also be acknowledged on Friday, 3 years to the day since her disappearance in Charlottesville. This Facebook page started to keep the search alive. Friday's ceremony meant to spread an important message.
That her life matters, and I think it gets lost on a lot of people that these lives matter.
Rob Phillips says it's come a long way, but more support is needed. At a time when Caitlyn Jenner is winning awards and praises, others experience backlash.
There's been more violence this year against trans people than there was last year. And I think that's because we're becoming in the spotlight.
Why do we need the divisions? You know, trans people just want to live. They want to be productive members of society, just like anyone else does.
They hope for the day when there will be just one community. People without labels and deaths for being different. Abrams says Friday's observance will be a good start.
It's sad. It shouldn't happen. Need to get angry, but walk away maybe with a little smile on your face that there's a light. There's now a light at the end of the tunnel, and we can eventually get to the point. We don't need to do this every year.
The Transgender Day of Remembrance ceremony will be held on Friday at 7 p.m. at Diversity Richmond. Everyone in the community is invited to attend.